I also want to thank the American College of Lifestyle Medicine for being a partner this year with us. They have given us a ton of speakers and really show us the evidence base behind lifestyle medicine and how we can incorporate that into our practices. It's really, really cool. I have somehow finagled to make available Susan Benigas. She is the executive director of the American College of Lifestyle Medicine. However, she also she's got an intro that's like a whole page and the back. So I'm just going to shorten it a little bit. Susan, I apologize if that offends you. I think she can hear me. She is joining us via Zoom, and she'll give us a little introduction. If you guys want, as I'm giving her the introduction, they have opened the doors to the food, which is just right over those curtains right there. So it's still in the same room, but on the other side. So if you'd like to get started and get in line for some food, that would be that'd be fine use of your time. I won't take offense to it. But Susan Benigas is the executive director of the American College of Lifestyle Medicine. She's had this position for 9 years. Susan is also helping to lead the effort to transform health and redefine healthcare. This is one of the big reasons why this meeting is going to be so great, because we're learning how to possibly redefine our healthcare. Not only in the United States, but she also does work around the world with the Lifestyle Medicine Global Alliance. Now, during her tenure, American College of Lifestyle Medicine has experienced such an amazing growth. This has been from fewer than 500 members, which is when I joined. I was in the 500 member or less club. But now it's more than 10,000 members. It's crazy. And that's over 9 years. ACLM's foremost priority is to help fill the gaping void of lifestyle medicine, including food as medicine, in medical education. So they actually do work with residency programs to come up with a curriculum for it. And then across the entire education continuum. Prior to joining ACLM, Susan co-founded the not-for-profit Plantition Project and the CME-accredited International Plant-Based Nutrition Healthcare Conference. Whew. So, Susan, I apologize that we're getting a couple minutes late to start on this. You can feel free to take a couple of minutes at the end if you want. But I'd like to welcome Susan via Zoom.
And so, shall I share my screen? Can you hear me?
Yes, yeah, share your screen, please.
Okay.
Hi, Susan, thank you.
Okay, will do. And it's just a pleasure to be with you, and thank you, Scott, for your incredible leadership. And it's just so outstanding. And it says that the host has disabled participant screen sharing. But I'm happy to just talk too if we're unable to share my slides.
Let's see. Okay, yeah, they said just talk. Yeah, if that's okay.
I will do that.
Apologize, Susan.
That. Well, yes, no problem whatsoever. Well, Scott, again, it is a pleasure to be with you. And I am so excited that, Scott, through your leadership and those who are fellow ACLM members in the Ogden area, that lifestyle medicine is being infused into healthcare. The vision statement of the American College of Lifestyle Medicine is a nation wherein lifestyle medicine is the foundation of health and all healthcare. And, you know, when a earthquake hits a bridge and the bridge crumbles, what does that tell us? It tells us that the infrastructure, the foundation of that bridge was compromised. COVID very much was like an infectious disease earthquake that hit our nation and we crumbled. It showed that the health infrastructure of our nation had been compromised. And it just really shone a bright light on the urgent need to address the underlying conditions that exacerbated the virus's most harmful effects and the disproportionate income on our underserved populations. And this really made lifestyle medicine all the more relevant and urgently needed because those underlying conditions that compromised immunity and made vulnerable, laid bare our population, are lifestyle related chronic diseases by and large. And that's why the American College of Lifestyle Medicine exists. It was in 2004 that visionary physicians came together and saw that there was no other field of medicine that represented evidence-based therapeutic lifestyle intervention to treat and often even reverse already existing chronic disease as well as select autoimmune disease. And prevention, the American College of Preventive Medicine, had already been around for decades at that point. And while had done an exceptional job of preventing infectious disease, already, even 20 years ago, there was an alarm about the rising trajectory of obesity and chronic disease. And when we look at our population today, when over 60% of American adults have already been diagnosed with one chronic disease and over 40%, two or more chronic conditions, and now far too many children are being diagnosed with what used to be adult chronic diseases. When type 2 diabetes can no longer be called adult onset because so many children are being diagnosed with this degenerative condition that degenerates far more rapidly in young growing bodies, it should sound alarms across this country that we must take control of our health care system and truly transform it into one of health care. For far too long, we've had a system of really disease and disability care that's been focused on diagnosing symptoms and treating those symptoms with ever increasing quantities of pills and procedures. Whereas what we really need is what lifestyle medicine represents. It's about treating the root cause, about identifying and eradicating the root cause of disease with the clinical outcome goal of health restoration, as opposed to simply disease management. And the definition of lifestyle medicine is a little longer than this, but in a nutshell, it's the use of evidence-based therapeutic lifestyle intervention to treat, reverse, and prevent lifestyle-related chronic disease. And it's based on 6 pillars. And those pillars represent a whole food, plant predominant dietary lifestyle, regular physical activity, restorative sleep, stress management, the avoidance of risky substances, and the power positive social connection in our lives that brings meaning and purpose. And it's these that really become the foundation of health. And we know too that food trumps all. Even in the 2019 Institute of Health Metrics and Evaluation Global Burden of Disease report, in looking at data from nearly 200 countries, it showed that it's what people are and are not eating that's the leading cause of disease and death across this country and around the world. And when, Scott, you even look at clinical practice guidelines from virtually all of the major establishments and organizations, medical professional associations that represent prevention and chronic disease treatment, and virtually all will recommend lifestyle intervention as a top guideline. Yet that has not been addressed because our medical professionals have not been trained in evidence-based lifestyle medicine. And we know that most physicians coming out of medical school have received very few hours, if any, on clinical nutrition and the use of therapeutic lifestyle change to treat and reverse chronic disease. And this is the foremost priority of the American College of Lifestyle Medicine, to fill that gaping void of lifestyle medicine and food as medicine, exercise as medicine, across the education continuum. And that's from pre-professional to undergraduate medical education, graduate medical education, on through continuing medical education. And we have a robust offering of resources through the American College of Lifestyle Medicine. We offer a free comprehensive culinary medicine curriculum with syllabus developed by Stanford's Michelle Hauser, already been downloaded nearly 9,000 times. Other free resources, including Lifestyle Medicine 101 by our president, Dr. Beth Frades of Harvard. Our lifestyle medicine residency curriculum is now licensed into over 200 programs across the country, over half of which are family medicine programs. And our continuing medical education is robust. Everything from the remission of type 2 diabetes and reversal of insulin resistance certificate course to the Foundations of Lifestyle Medicine board review course that's used as preparatory material for those wishing to become certified in the field. And I'd really encourage many in this room tonight and attending this conference to consider certification in the field. The certification exam offered through the American Board of Lifestyle Medicine will be hosted the end of November and early December this year, and you're able to register and take that exam at a Prometric testing center. And the Foundations of Lifestyle Medicine board review course, wonderful preparatory material, and attending the Lifestyle Medicine Conference that will be held the end of October in Denver this year. And many other educational offerings fulfill the American Board of Lifestyle Medicine prerequisites. And MDs, DOs, as well as PhDs and master's level professionals with degrees in healthcare related fields are eligible to sit for the exam, and would really encourage you to do so. And the American College of Lifestyle Medicine, we are the nation's medical professional home for physicians, allied health professionals, healthcare executives who are passionate about leading with a lifestyle medicine first approach to real healthcare, to treating root causes of disease. And I would encourage you all to join the American College of Lifestyle Medicine. Take advantage of the incredible benefits, patient-facing resources, clinical practice resources, webinars, discounts on education, certification. And it is a magnet for purpose, passion-driven people who understand what's at stake and want to be part of the change that we know is so desperately needed in our country. And so please join and become part of that galvanized force for change that ACLM represents. And the last thing I'll share with you this evening is that ACLM is very active on Capitol Hill. Our advocacy efforts, which have been underway in the past few years, have heated up. And quite frankly, COVID, as I started my presentation today, has shown that bright light on the urgent need to address these conditions that lifestyle medicine addresses. And so the ears on Capitol Hill have perked up. And even the White House Conference on Hunger, Nutrition, and Health that took place in October, first time in 52 years that something like that has been hosted. And ACLM's commitment to that was showcased by the White House. We made a huge commitment, part of which was 100,000 complimentary resources to register for our 5.5-hour CME CE accredited Lifestyle Medicine and Food as Medicine Essentials course. It's comprised of a 1-hour introduction to lifestyle medicine and the first 2 modules of our multi-module Food as Medicine course, including nutrition for prevention and longevity and nutrition for treatment and restoration. And all of you are invited to register free of charge. We waive the $220 fee at lifestylemedicine.org/WH conference for White House Conference, lifestylemedicine.org WH conference, and share that with your colleagues as well. We hope that it plants the seeds of change and really serves as a bit of a catalyst to start this paradigm shift across our country that's so needed amongst our medical professionals. And another part of our commitment was a 50% scholarship commitment to train 1 primary care provider at every federally qualified health center across our nation, because what we represent, lifestyle medicine, is the health, hope, and healing that our nation, our world, so desperately needs today. And so I want to just thank you all for being part of this conference. Thank you, Scott Moore, for your incredible leadership. And Utah, hey, you have the opportunity. Let's make Utah the state that is leading with a lifestyle medicine first approach for the benefit of the providers, for the benefit of patients, providers, and families and communities, because too much is at stake. And we cannot allow the trajectory of chronic disease to squelch the potential in God's people. It's time to address this, and we can do it together. And so thank you so much for allowing me to be with you this evening, and I wish you all the best for the rest of your conference.
Thank you so much, Susan. Thank you. Now, I know personally, I'm going to be in Denver in October. It is over Halloween, so my kids might not be super happy about that, but they're not coming. So I will be there, and then I'll come give them Halloween afterwards when we're done. But this is kind of what I heard was the train is already kind of up and running. It's barreling forward, and we have the opportunity to get on the train. So Susan, thank you so much. I really do appreciate all the work that you do, and we actually need to return and get to our CME now. But
Yes.
Susan,
Thank you, Scott. I wish you all the best.
Thank you. You too.